Welcome to the AOA Orthopedics Leadership Podcast. My name is Matt Schmitz, and I'm excited to have a good friend of mine, Neil Sheth, who's joining us today. And this podcast is a little bit different. This is geared towards some of our younger members, the resident leadership forum, the emerging leaders, and it's about obtaining efficiency early in your practice. And so, Neil, why don't you go ahead and introduce yourself?
Yeah, Matt, thanks for having me today. Excited to have this discussion with you. My name is Neil Sheth from the University of Pennsylvania. I am the chief of orthopedic surgery here at Pennsylvania Hospital, but also an adult hip and knee reconstruction surgeon. Matt and I actually met back in 2019, 2020, when we were both LFP fellows, Leadership of Fellows program through the Academy, and spent a year together on multiple different sort of aspects of leadership through the Academy. And one of the things that we had a chance to go to was the AOA meeting, and actually have a pretty nice leadership, I think, forum talking about sort of efficiency in practice and efficiency in sort of like balancing your leadership responsibilities in practice. And I think Matt and I have had some great conversations over the last several years about some of this content. And we thought that it would be really great to put together a short podcast for our listeners that I think would help them in different stages of their practice.
Yeah, Neil, I pride myself on being a pretty organized person. And I walked away after meeting you and said, that is the most organized person I've ever met in my life, the way you schedule your life. And I think that I've learned some key concepts from you. And that's what we're kind of hoping to bring to the podcast listenership today is some concepts earlier in your practice of what you can do to best maximize your efficiencies. And so, we were going back and forth on what we should talk about and came up with a few key concepts. And the first one that Neil pointed out is that managing your time isn't enough. You need to also manage your attention and energy. So Neil, what do you think of, what do you mean by that?
Yeah, so, I think that one of the biggest things that I've learned, I think, in the last decade and a half in practice is that, everyone talks about this term time management and managing your time effectively and efficiently. And, you and I have gone to a number of talks and read a number of different books to try to get more things that we can add into our repertoire to help manage time. And I realized that it's not just managing your time. It's actually managing your attention and focus as well as your energy. And so to me, managing time means that a specific task will take you X amount of time, assuming that you have the appropriate attention and the appropriate energy to devote to it. So for example, and I talk about this with a lot of our trainees and residents and fellows and say, hey, look, you're going to send me a new draft of a manuscript. And I'm going to give it some real time to focus on this. And this is not a terribly long manuscript, so I need an hour of my undivided attention to really focus and think about this paper on how we want to put it together. The appropriate time to spend that hour is not at the end of 8 cases in a day when I just finished a monster 3-hour revision, when I am physically tired, haven't probably eaten in a few hours, haven't had any water in several hours, I'm dehydrated. Because at that time, my attention and focus is pretty low and my energy level is really low. And so that 60 minutes now becomes 90 minutes or 2 hours, or I'm starting to read this. And since my attention is not there, I'm going to get distracted because, now the patient's family wants to talk to me again. And the resident called me back because there's something else I had to do. All of a sudden, this goes on my to-do list. And then I don't actually get to that paper and I don't get that deadline done. So I think it's managing your time, assuming you have attention and energy for it. And then that way you can schedule things on your calendar accordingly, right? And not doing it at the wrong time.
Yeah, and I think we'll get into some of that as we continue to talk, because I've learned some tips and tricks on that from you. Another key concept is that work-life balance. Really, it's not a balance. That's an incorrect term. What do you think about that concept of work-life balance, or what both, mentors to both of us, Jack Flynn, says it's more of a work-life integration?
Yeah, that's a great thing. So again, Matt, Jack Flynn's been a great mentor of mine all through residency. And he was probably one of the first people that I interfaced with that really started watching someone who was highly productive professionally, but highly dedicated to his family and his home life. And I really tried to figure out, how is this even possible? Because most of the other mentors that I had, even they may have been great mentors technically and on the content side of orthopedic surgery, weren't great at balancing, all the things that they were really responsible for, that they were involved in. And so I think that the term work-life balance, which has really become a buzzword, I think, for today, and I think the next generation is really focused on this, and it's important. I think work-life integration is a great way of putting it, but I actually look at it as really like work balance and life balance. So you're not looking to balance one at the expense of another. So that does not mean I should be working all the time and so focused on my work that I neglect my family and my personal responsibilities, or let me skirt out on work so I can go spend some more time with my family and do the things that I enjoy doing. I think we've all spent a lot of time to get to the point that we are where we're at in our careers. And so we have spent time to learn a craft and learn a trade to do our work properly. So it's a matter of, I think, balancing your work, but balancing your home life. And I think the term for me, integration, again, is a great term that Jack Flynn talks about. For me, is minimizing the residual from one to the other, which means when I'm working, I am fully focused and working. When I'm home, I'm not only just physically there, but I'm mentally engaged in that home and trying to minimize the residual from work. With our profession, I think as orthopedic surgeons, you're going to have emergencies that occur that don't only occur during business hours between 9 and 5. So those times I got to take that phone call. I got to talk to a resident. I got to talk to my chairman. I got to deal with something. That's fine. But those should be fewer iterations of that happening in your life than that becoming the norm, where there's this blend that comes over and all of a sudden you're not really focused on either one of the two.
Yeah, yeah. And especially, I've got two now teenage daughters, but when they were younger, I remember I missed a couple of soccer games and for work reasons that I probably could have scheduled better. And I got home and my daughter, she had a tally list and it was, here's the games that you missed. And it was really eye-opening to me. And I made her a promise. This is probably 7, 8 years ago. I made her a promise. At the end of that list, I promise I will make far more games than I will miss. My bad for missing the 2 games today. But your kids, your family sees that as well if you're not present at home.
Yeah, I mean, it's unfortunate that you had to learn that way, but that was impactful for you. That probably made a huge change in your approach to what you're doing. And again, at that point, you were not saying, listen, I'm going to make sure I get to every soccer game and I'm going to skirt on some of the responsibilities that I have at work, or I'm not going to take an opportunity to do something which may be great for my professional development. I think what you're trying to say is you have to have a better system in place. And the system that you have to have in place is, how do you handle when you say yes to something professionally without compromising your home life?
Yeah, you're right. Like we learn orthopedics and we learn research in residency, but the impetus behind this conversation and this podcast is how do you learn some of those efficiencies, especially in the first 5 to 10 years of practice, or starting that even in residency. And that goes to our third key concept, is that creating habits for work balance and home life balance starts early. It starts in medical school and residency. It doesn't start after you pass your boards, or if you're trying to start it after you pass your boards, you're behind the game on it.
100%. And I think the problem is that specifically in medicine, but I don't think that other professions are immune to this, but I think that we spend so much time focusing on learning our trade and learning the language of orthopedic surgery and to learn our craft to be able to take care of patients, that there are some of these other skills that are really critical and important for us to be able to function properly and function effectively that we don't learn. And we just assume that at some point it'll kind of gel together. And once I get comfortable doing my hip replacements, and it'll be much easier for me to focus on it at that point. I think you're absolutely right. I think the concept of this starts early. This needs to have small habits that over time will stack on each other. You'll make things happen which become second nature to you. And then you're like, oh, well, I need to add this on or add this to this list of habits that I already have, which will make me more effective at doing whatever it is. But I think this starts early, and I think we've got to be focused on it. And I think that, getting that balance, as soon as you think you've got balance, that's when you can go out of balance. So you got to continually work at this and actually make it an iterative process. What you are worried about today may be very different than what you worry about in 5 years from now.
Yeah.
Right? And so it's got to kind of be able to change and adapt and mold to what you're looking at and what's important to you at that time.
Yeah, and I think we're always getting more efficient. I remember back to when I was a medical student or a junior resident, and I thought at that time I couldn't possibly be any busier than I am at this time. Now I look at myself 10, 15 years down the road, and I am 1,000 times busier than I was as a PGY3, right? And so we're always developing these skills and learning how to maximize those skills as well.
And Matt, think about even at this point for us, at about a decade and a half into our career, we're way busier now with more established practices, with more responsibility and leadership at the level of the hospital or in our residency programs and training programs than we were in the first 2 years of our practice, right? First 3 years of our practice. And so I am way busier with way more to do, with more responsibility, and I am more productive and less stressed out now than I was a decade ago.
Yeah. Yeah.
Right. And I think it's just because of that iterative process of continually fine tuning and recalibrating of what we're focused on, how to actually manage your time and energy and attention, but also really trying to fine tune your system so that it can accommodate what you want to do.
Well, let's talk about some of those specifics, the concept of scheduling your life, right? And
Yeah.
I know that you and I both do this where I live by my calendar. My calendar has chunks of time, and it's really important that I schedule time. When we were looking to set this up, it was here, let's put a block of time. Here's an hour. We're going to sit down and chat. So tell me, for example, you get invited to speak at a conference.
Yeah.
How does the process go from you getting invited to the day you give the talk? Tell our listeners a little bit about your process.
Yeah, so that's a great example, I think, to go over because, from some of the coaches that I think you and I have actually shared and some other leadership coaches that I've had, they say that as an orthopedic surgeon or as physicians, that's probably one of the biggest things that you run into trouble with over time. And so the example is, say, for example, you call me and say, hey, Neil, can you give a talk at a meeting that I'm chairing in August later this year? Yeah, of course, to support you, I'm happy to do this. And, it's an interesting topic. Great. I say yes today. I may put it on my calendar on my phone. Don't let anyone else know about it. It's 8 months away, and I forget about it until the week before. And then you happen to see me at a meeting, or you text me and say, hey, by the way, really excited to see you next week. Oh my God, I'm going down to see Matt at his meeting, and I haven't even put my talk together, right? And so it's not uncommon for us to see our mentors and our partners be on the flight, writing their talk together for the place that they're landing. So the way I do it is, you can actually see behind me my wall calendar. So I look first before I even accept the offer from you. And I don't ever accept an offer for any invitation unless I'm sitting in my chair in my office. I look at my calendar to make sure that there is no specific date on there around that time that I've got another previous engagement that I cannot move. Should not be on my wife's birthday that, oh, whoops, I forgot it's the same day. I know it's your meeting, Matt, but you know what? I can't move her birthday. And so that's the first thing I do to make sure there's no major conflict with a life event that's going on. Number two, if I look at that and say, okay, I have no other family obligation, I've got no other professional obligation. I didn't already accept for another meeting that somebody asked me to do something for. If that's the case, then first thing I do is I put it on my calendar there on this wall calendar. And I'm always looking 6 to 9 months out. And then the next, I'm going to put a calendar invite or basically put an entry on my calendar that says that I'm going to be away from this time if I have to travel for this meeting. And then I look at the topic and I look at the time it's going to take me to put together the work that I need to do for this meeting. And I block off 2-hour segments of time each of the 2 weeks, 4 weeks, and 6 weeks before that meeting occurs. And so I already have reminders built into my calendar to say, I need to put this talk together for Matt's meeting. And that's going to start, 2 months ahead of time. Yeah. If it happens to be a talk that I've given several times before, it may not take me that much time, but I've got the time blocked off to work on it. If I need to just update a previous talk, I may only need one of those blocks. If it's a brand new talk I've never given before and I've got to do some work, I may need all of those 2-hour slots to be able to finish it off. The nice thing is this allows me to not forget that I've got to do something on a given day or even in the future. And if I happen to be working on things a couple of weeks before and whatever task I'm working on happens to take me less time than I expected, well, I can look forward and feed this forward and say, let me start working on Matt's talk now, right? Yeah. Because I've got more time. I just, a little windfall today and I got a case that canceled. All right, you know what? I've got some time here. Let me take this 2-hour slot to get some other work done later on and pull it forward. But a lot of this is sort of preemptive planning, right? And making sure that you don't let these things get behind.
Yeah, I think the concept of owning your schedule is really important. And, I use an Apple iCalendar and Neil, you know this, my wife is far more important than I'll ever be. She was the president of the American College of Emergency Physicians a couple of years ago. And so we've got this elaborate calendar. So I knew when she was out of town, when the kids have sporting events out of town. So similar, if I get asked to do something, the first thing I do is I go to that family calendar. Where is everybody? Is this a time that I can't be out of town? And so, and I block off OR time, I block off meetings. And so that I am responsible for my calendar. I know exactly where I'm supposed to be and what I'm supposed to be doing, but so does my wife. Right.
Yeah.
And now my daughter's a 15-year-old in high school, and she has access to the calendar. She knows where dad is, so I think that's really important early in practice. I wish I'd have understood that more, is really the
Yeah.
concept of owning your calendar and using your calendar like a to-do list to
Yeah.
help you accomplish those tasks is important.
And you made another mention of something very important, right? So it's actually communicating. When you own your calendar, is communicating what you've done with your calendar with other people that are important to you. So, right, your spouse, your family, they need to know what's going on, because it can't be done in a silo where you're only looking at it.
Right.
I actually just sat down with my administrative assistant. We do this every 6 weeks, looking forward 3 to 6 months, because things change and she may not know about it. And it's important for her to know if I need to close down a clinic or actually shorten a clinic one day, or I can only do so many cases on a day because I'm going to be traveling that evening. But having her know just takes all the stress off of our entire team. They know exactly what I'm doing.
Yeah.
And so I think that's really, really important, owning your calendar and then being able to communicate about it. So people that need to know do know.
Yeah. I mean, and a lot of that comes from failed experiences, right? You've heard my funny story where there was a day I was scrubbing in at about 7:30 and I got a phone call from my daughter, and the question was, Dad, who's taking us to school today? And I pulled up the calendar,
Right.
and I was like, oh crap, my wife's out of town. We forgot to schedule the nanny today. And I said, make your sister breakfast. I'll be there at noon. You can go to the second. But right. And so now what I built in is every Friday I look at next week's calendar and I make sure
Right.
that everything's accounted for. But it's learning from those failures or the missed times, right?
Yeah.
And so tell me a little bit about how you set up your practice early with regards to your clinic schedule, and do you reevaluate that on a regular basis? You talked about your MA and your admin assistant. Tell me what pearls could you give folks that are just getting into practice about setting up their clinical practice?
So I think at the highest level, my biggest thing that I kind of preach to our med students, residents, and fellows is, when you enter practice, you've just finished and completed your residency, your fellowship, and you've been waiting, and this is delayed gratification. You spent all this time training. It's time to start working. You're excited. And for the most part, I'd say 95% of us, you start working and you're not that busy. You're not seeing 70 patients a day in clinic. You don't have 16 cases on the schedule for this week in the OR. So what do? I think the most important piece of advice that I give is that your first couple of years of practice are designed to break bad habits and create good habits, right? So start creating a system when you're not busy.
Mm-hmm.
When you're not seeing a lot of patients, schedule 20-minute appointments. Talk to that patient, even if they don't need surgery, right? Start building your brand early, right? Start getting a sense of how the system's going to flow. Figure out what help you have, figure out who's going to be a part of your team, and figure out what they need. Figure out what parts of your system are working well and what system elements are not working well. The key thing is, I think, when you have time, use that time wisely to create a system, and have a little slack in the system so you can take a step back every now and then and evaluate the system that you're actually designing.
Yeah.
And I think that's really like the most critical thing I think I can tell somebody that's starting out early.
Yeah. The other thing that someone taught me was, it may only take you 2 hours to do a case when you're a fellow. Add in 25 to 50% longer those first couple of years when you're figuring things out. And then you reevaluate that and you say, all right, now that case it took me 3 hours 2 years ago. Now it's only taking me 2 hours. So you can really get a handle of how long, because man, one of the biggest complaints I hear from nursing staff or OR staff is, Dr. So-and-so says this case is going to take 2 hours and it takes him or her 4 hours. And that's super frustrating. So build a little bit of that slack into your system early, and then reevaluate and modify it.
And what you're talking about also is really setting expectations around you when you're starting out. I don't care if you did your residency at the place where you work or you did your fellowship and you feel like you know a lot of people, but all of a sudden you're taking care of patients on your own at this point, or right with your team. And your fellowship director is not walking into the OR to help you out and get you through this procedure. And you have a very short window to make a first impression.
Yeah.
The last thing you want to do is like, oh, it's a primary hip, we're going to be done in a half hour. And then that hip takes you 5 hours because you didn't properly preoperatively plan. And you happen to have the urology scrub team with you today because you don't have a dedicated team. And while the the trays are contaminated and this is delayed, and all of a sudden, your OR staff's looking and say, oof, I don't really want to scrub with Dr. Schmitz again because this is really painful. Yeah. And when that happens a few times, all of a sudden you get this label, right? So I think that, again, that what you're talking about is you're creating a system, expect things to take longer than they are, because you're going to look great when you say this revision is going to take me 4 hours and you're done in an hour and a half. To be like, wow, this guy's really, really good, right? And it's not that anything more than you've spent some time preoperatively planning. That's the other thing I'll tell our trainees is when you're starting your practice, spend time playing the game before you even play the game, right? Yeah. So, which means spend time pre-op planning, formulate a dedicated, detailed plan, give it to the entire staff, everyone in your OR, med students, residents, fellows, and say, yeah, I think this is going to be a really long, big revision. And when you come out on the other side of that and you're like, wow, I was 50% faster than I thought. Yeah. All of a sudden you're starting to build your team because people are like, well, I want to work with this person. Yeah. Right. But you have that time to do that early on, and it takes time to get there.
Yeah, no, that's great, Neil. The other thing to talk about is using your time wisely. And you are very adamant you don't use a to-do list. Yeah. I do use a to-do list, but it's for some of this, it coordinates with my calendar, right? And so I know that this to-do is going to take me an hour, and so that's the integration. But tell me about your perspective on using your time wisely.
Yeah, so you and I have had a lot of discussions about this, and I've learned a great deal from you as well. There's definitely some apps, and there's some different little things that you do that I've also incorporated into my process. So I think this kind of comes back to that first concept of understanding how long it takes you to do something, right? And so if I'm going to read a brand new manuscript that a resident has sent me, I'm going to give it a good 60 or 90 minutes. I'm going to have a slot dedicated on my calendar to do that. The reason I do that is because if I have a to-do list, I think the most common error is if you're not managing your attention and your energy, and I sit down to do this, and all of a sudden I don't get through this manuscript, it goes on my to-do list. And then by the time I get out of the next OR case, there might be something else that comes up, and you're always reprioritizing that list. Yeah. And there's a risk that there are things that continually get pushed down all the way because other things keep reprioritizing above it. And then all of a sudden you are sitting there and you're like, oh my goodness, it's been 9 months and I have not read that manuscript for this resident. Yeah. So instead of having a to-do list, I just look at my email and I look at my calendar, and those are pretty highly synced. And so if there was something that I needed to do, and for example, I had a 2-hour slot today to work on a talk that I'm giving next week, and something came up, but instead of putting that on my to-do list, I just took that time slot and moved it till tomorrow afternoon and said, I'm done with clinic around 3 tomorrow. I'm going to spend 2 hours working on this before I go home so that when I go home, I am not thinking about work and I will still have everything done. So that's how I avoid using a to-do list, and I just use my calendar to use specific slots as things that I need to get done.
Yeah, and being efficient and moving that stuff. That's the other thing that we've talked about is that when you're traveling around and giving talks, you've got time on flights as well. And if you use that time wisely, now you should not be putting together the talk that you are going to give, right? Correct. But that's where I can review a manuscript or edit a manuscript or answer emails, right? And so as opposed to watching a movie for 2 hours, right? And so that's one of those things that I think was really hard for me to understand, but it's amazing how efficient you can be on a 2-hour plane flight from Chicago to San Antonio, for example.
Yeah. No, there's no question. I mean, for me, travel time is definitely work time. And, for me, like sometimes I'm on flights that are 10, 15 hours long all the way to Asia, and I've got a whole bunch of time on those flights. But again, I plan those times pretty wisely. Yeah. Right. I'm not going to, again, it comes back to that same concept that, it'll only take me an hour to do this, but that's assuming I'm not jet lagged and it's not in the middle of the night somewhere. Yeah. Right. And so if at those times I don't have the attention and energy to focus on work, that's when I'm going to watch the movie for an hour and a half and say, I need to get my brain to kick back right now and not do any work, do something that is mindless that I don't have to think. But if I'm dialed in, I'm in the zone, and I've got a nice 3-hour segment before it gets to a point where I really should sleep in order to arrive at my destination and be wide awake, well, then let me get some work done during that time. But it's like we were just talking about. When I look at my calendar, like I say, like I'm not going to put a task in that slot of time that's going to take me longer than that slot of time, assuming that I've chosen wisely with my attention and my energy.
Yeah, yeah. And you talked about protecting kind of the personal time or the family time versus the work time. Sometimes you can, we've got a concept in our family, what we call bizcations, where someone has a work trip, but it's at a cool location. So we tack a couple of days on the beginning or on the end, and the family goes out, right? So one of the couple is working, but then there's some family time built into it that gets the kids excited about these trips as well, right? And so there is some integration there that I think what I learned early in my career is that you don't have to be two separate people, is that if you do it the right way, you can integrate some of those things together and make you more efficient as well, where that took me a few years to learn.
Yeah, no, that's absolutely true. And that's something that Jack Flynn probably taught me, and at least I saw by observation when I was a resident, where he's all over the place and probably one of the most accomplished orthopedic surgeons on the pediatric orthopedic side. And got a huge family, but would be going to Argentina and is taking his daughter out of school for a week because she's like learning Spanish. And it's like, you can come with your dad, but you don't get to speak any English this entire week, right? You're my translator, right? And you'll have business, you'll have time to be with me, but I've got to do some work, and you're still learning while you're here because this is in line with what you're doing in school. Matt, one of the things that I get a lot of questions about from residents and fellows is kind of how do you handle your weekends?
Yeah.
So this is not a weekend where you are away giving a talk, so away from the family. This may be a weekend where maybe your girls are not playing a sport, right? So you've got open time, but they're going to want to see you and spend time with you, and you still have work that you need to get done.
Yeah.
How do you handle that? And I wonder if it's a little bit different for you and I, but it might be a lot of similarities, I think.
So I think early in my career, when my kids were young, they got up at 6 a.m. Now I've got two teenage daughters that love to sleep in till 10 or 11 o'clock on Saturday and Sunday. So that means I've got a block of time in the morning where I can have a cup of coffee and get some work done and not have it eat into the family schedule. So I'm not taking chunks of time from noon to 4 on a Saturday afternoon. That's family time. And in the evening, that's my wife and I's time. We call it bubble time, where nothing can intrude on that. But when the kids were younger, when they went down for naps, that was my block of time. And now those naps happen to be in the morning because they're teenagers that we have to get them out of bed at 10 or 11. And so that's what I do. You?
Yeah. So it's not dissimilar. So, I typically get up early on Saturdays and Sundays. I'll get up at 6 a.m. and, hit the gym or do something for an hour if I want. And then by between 7 and 9 or 7 and 10, like I'm getting work done. Good thing is, like, my wife will wake up a little bit late, and by the time she has coffee and joins the real world, like it might be 9 o'clock, 9:30 in the morning. So I haven't taken any time away from her. But the nice thing is that I can get work done in the morning. And, my father-in-law says, hey, let's go grab a beer and go watch the Penn State game at noon. I don't ever feel like I haven't been productive enough to go enjoy that. Yeah. I can spend the rest of my day doing whatever I want, knowing that tomorrow morning I'm going to get up and do work again. But coming back to the concept of before, say Saturday night, we end up having a late night. We have a nice dinner. We go out, we do whatever. And then I wake up on Sunday morning and I'm tired and I don't feel like getting out of bed to do work. Well, I'm looking at my calendar and I'm moving that slot of time where I was supposed to do something to another spot on my calendar during the week.
Yeah.
Right. So
like you hinted at, because if you're not going to be productive during that time,
there's no point.
It's better to take care of yourself.
Absolutely. Sleep in a little bit, right? Cook breakfast with the family. I mean, whatever it is. And I'll tell you probably the best thing, and I think I told you this last year, but probably the best compliment I got from my wife this past year is that there's a book that I was working on for 2 years with my mentor that we just published this summer. And my wife had no idea that the book was even done, right? Yeah. She knew I was working on this book, but it did not impinge on our family at all. And she's like, when did you even get this done? Funny thing is that my father-in-law knew, because we have a house at the shore. So during the summer times, we're always there on the weekends. And I'm always up at 6 a.m., at the dining room table with my headphones on, getting work done. My father-in-law typically wakes up early and has coffee and is reading the paper, and he goes, well, you're up every single weekend getting stuff done, but then I can hang out for the rest of the rest of Saturday and Sunday, and it didn't impinge on anybody. No one felt that I was like out of pocket, and that was a lot of work to get that book done. So that actually showed me that my system really is effective, at least for me, with what my family situation is and the work that I've got that I've taken on as a responsibility.
Yeah, that's great. We probably should wrap it up just for time's sake, but
yeah,
you and I maybe should write a book about this at some point, because
I think we should.
These are the things that
honestly, that's a great idea, because there's a lot of stuff out there for the business world, right? Where people are sitting at a desk all the time, or they're traveling and they're reading emails all day. Not a lot of stuff written, if anything at all, for surgeons who are in hyper focus mode for short periods of time or potentially really long cases.
Yeah.
And things are still piling up in your professional life. There are things that are piling up in your personal life while you're in a zone of hyper focus in your sanctuary where you can't really worry about anything else.
Yeah.
So I think there is definitely a role for something that may be more tangible for a lot of the people in our profession that I think would be helpful.
Well, Neil, thanks again for joining me today, and I hope that some of our younger AOA members could glean a couple of things from this. And again, I think that one of the take-home points to remember is that you're never a finished product. You and I are still working to be better than we were yesterday.
Always.
Yeah.
Yep.
So thank you very much, and it was good to see you, buddy.
Great to see you as well, Matt. Thanks so much for the opportunity to be a part of this with you. And yeah, great discussion. Hopefully this is helpful to someone, just as some of the little tidbits that we went over that have, I think, really been helpful to us.